It is one of the most basic health screening tests, yet also one of the most important. Your cholesterol levels can reveal really a lot about your risk for cardiovascular disease.
King 5's Christine Pei breaks it down for us in this week's HealthLink.
Being in good shape and being younger doesn't necessarily guarantee healthy cholesterol levels. So how high is too high when it comes to your cholesterol, and what do you do about it? A local cardiologist tells me if you have high cholesterol, don't ignore it.
Those levels over the course of somebody's lifetime is one of the single best predictors of a risk of heart attack or stroke.
Dr. Amy Cheney is a cardiologist at Overlake Medical Center. She says when you get your cholesterol tested from a blood draw, doctors will focus on two separate levels.
Really want a high level of HDL and as low as possible of LDL.
HDL is short for high-density lipoprotein. That is considered good cholesterol. LDL is low density, which is known as the bad cholesterol.
Circulating LDL is really the culprit.
Here's why. Over time, high levels of LDL cholesterol can build up as plaque in blood vessels.
If it adheres to the coronary arteries, which are the arteries that supply the heart, then that can lead to a heart attack.
And any blockage in the vessels in the brain can lead to a stroke.
So what we're trying to do is to reduce that as low as possible, because if there's not the building blocks to create this plaque, if there's fewer and fewer of those building blocks, then people are less and less likely to have adverse events, which we think of as heart attack and stroke.
Ideal levels of LDL are below 100 milligrams per deciliter of blood. Healthy levels of HDL should be above 60 milligrams. While older people have a greater risk of concerning cholesterol levels, young people should pay attention too.
That includes whether you're an adult, a young adult, a child. Believe it or not, 5 to 7% of children have elevated cholesterol.
High cholesterol can also be hereditary.
If you have a first-degree relative, mom, dad, brother, sister, who has had a heart attack at a young age, we know there's something going on in the genetic material that's predisposing people in that family to have those events.
It's why doctors recommend getting cholesterol tested regularly. Low-risk adults every 4 to 6 years, but if you're at higher risk, more often than that. You can lower bad LDL cholesterol levels by cutting saturated fat from your diet, things like red meat, fried foods, and butter, and exercising regularly. Eating more foods rich in HDL cholesterol, like avocados, nuts, and fish, may also help. Part of why HDL is good is because it takes excess cholesterol in the blood back to the liver, where it is metabolized and removed from the body.
Get your cholesterol checked if maybe it's completely normal and maybe it's something that just needs to be monitored. But on the off chance that it isn't, it's something you want to know about sooner rather than later.
For some patients, doctors may prescribe medication that reduce cholesterol levels in the blood. Dr. Cheney says it is a case-by-case situation, so it is important to talk to your doctor. For HealthLink, I'm Christine Pei.